Amyotrophic lateral sclerosis disease, ALS, or Lou Gehrig's disease by Noah Butler. ALS is a motor neuron disease that impacts the nervous system. It is characterized by the progression and eventual decline of motor neuron cells that control muscle movement. ALS is a chromosomal mutation that occurs on chromosome 2 through 11, caused by SOD1, the SOD1 gene. ALS affects 30,000 people in the U.S. 60% are men, 40% are women, and most of them are over the age of 50. There are around 5,000 new cases diagnosed in the U.S. every year. Some famous people who are diagnosed with ALS are Lou Gehrig, and that's where the name comes from. Lou Gehrig, he was a famous baseball player. Stephen Hawking has this disease. John Stone, someone who used to work on the Sesame Street, and Dwight Clark. What ALS is caused? Some doctors do not really know what causes ALS. The research into the cause of ALS continues. Most theories focus on environmental factors like exposure to toxic or infectious agents, viruses, physical trauma, behavioral factors, occupational factors, and about 10% of all ALS cases are passed down from parent to child, which is called familia. Symptoms of ALS include muscle twitches like arm, leg, shoulder, and or tongue, muscle cramps, tight and stiff muscles, slurred and nasally speech, difficulty chewing and swallowing, and to which a person can get ALS. There's the sporadic, which is environmental factors, and familial, which is genetics. Sporadic causes are caused by an unknown reason, but may be due to environmental factors or genetics. Sporadic cases of ALS are the most common, making up about 90% of all cases. Familial genetic cases are hereditary, meaning they are passed down from parent to child. Familial cases of ALS make up about 10%. This was showing like the gene types and stuff. So humans have a total of 46 chromosomes. Of 23 pairs of chromosomes, 22 of these chromosomal pairs look the same in both males and females and are called autosomes. The final pair are 6 chromosomes and are different in males and females. Familial with autosomal dominant transmissions. Autosomal dominance is a pattern of inheritance where an affected person has one mutated gene and one normal gene on an autosomal chromosome. Parents with this pattern have a 50% chance of passing the mutated gene on to their children. Autosomal recessive is a pattern of inheritance where both parents are affected with one mutated gene and one normal gene on an autosomal chromosome. A child has 1 in 4 chance of contracting the disease, but a 50% chance of being a carrier. And this is what it would look like. The pedigree. This is what the Punnett square looks like. So there's 4 different treatment options. Riluzole, a medication that reduces damage to motor neurons. This medication may increase survival by several months and extend time before a ventilator breathing support machine is needed. This medication does not reduce or repair existing damage to motor neurons. And Eduran is another medication. It's an antioxidant that may slow the decline of physical function. The medication does not, however, reduce or repair the existing damage that has been done. It's diluted by intravenous infusions, is administered to patients in 2-week 1 on, 2-week off cycle. Palliative care relieves symptoms of ALS and can improve patients' quality of life. This supportive care, typically produced by multidisciplinary teams of healthcare professionals and home care providers and hospice.